Hi, my name is Windsor Shuey, and today I'm going to be performing colostomy care. I do have a cold, so I apologize if I'm hard to hear. I'm trying to talk loud, but I've lost my voice, so I'm doing my best. I'm going to go ahead and lower my camera so you can kind of see my setup here. All right, so I'd enter the room and I would perform hand hygiene. I would close the curtain for patient privacy, and I would ask the patient their name and date of birth. Mr. Smith, can you please verify your name and date of birth? Awesome. So today we're going to go ahead and perform colostomy care, and what that means is I'm going to go ahead and remove your pouch and the ring around the stoma, and we're just going to go ahead and clean it up, and then I'm going to replace it with all new stuff. Does that sound good to you? Excellent. All right, so I'm actually out of gloves, otherwise I would apply fresh gloves, and then I would begin by removing the colostomy bag. So in order to do this, I'd pop the ring off. This is already kind of hanging off. I would go ahead and I would measure the volume of the waste in the bag, and I would go ahead and dump it in the trash or whatever waste situation the hospital provides. Next, I would go ahead and I would stick this on the side, and then I would begin by slowly removing this to the best of my ability, and I'm going to pretend this is new for later. All right, so now I have my rag and my towel to dry. So first I will begin by cleaning the stoma just gently around it with warm water. And I would be assessing the stoma during this time. I'll throw it away. And then I'll go ahead and I will dry the stoma and dry around the stoma. Perfect. All right. I will assess the skin. The stoma is pink, it has good perfusion, the tissue integrity is in good condition, everything looks great. So next step is to go ahead and to measure the stoma. So I would go ahead and take my measuring device and figure out what size stoma is, or what size pouch is going to be best. And in this case, it is the 45 millimeter one. So I would then take my new base plate, and I would cut it to size, and I would make sure, at this point we're going to pretend that this is ointment. I don't have an ointment tube, so I would put some skin barrier cream here if necessary or if indicated. All right, and now that the skin is dry, I've applied the protective skin prep, and again it's fully dry. I would go ahead and place this over the stoma, and I would press down really hard, make sure that the barrier is set and solid. Perfect. And then next I would go ahead and take my new bag, and I'll go ahead and place this over the stoma, snapping it in place, making sure it doesn't leak or anything like that. And then I would go ahead and close the end of this. We'll do it this way. Just make sure that it's closed. Perfect. All right, so that's closed, and then I would go ahead and I would discard of all of my my waste here. I'd perform hand hygiene. I would take my gloves off, perform hand hygiene, and then I would go ahead and position the patient. I would ask the patient if the patient is comfortable, and I would make sure that the call light is within reach. And then I would go ahead and I would leave the room. I would lower the bed into the lowest possible position. I would raise the bed rail. And then I would go ahead and step out to document the procedure and inform the provider if there's anything noteworthy that the provider needs to know about. Thank you.